Hello, my name is Al Ali. I'm a professor of plastic surgery at UT Southwestern in Dallas. There's an overall subject that a lot of patients would want to ask about, which is tummy tucks, or the medical term for that is abdominoplasty. It's generally done for people who have either extra skin on their belly and or bulging of the belly. The most common patient that you treat for that is a woman who's had a couple of babies and her belly skin is a little redundant or excessive, and there's a little bit of a bulge. The other group of people are people who are massive weight loss patients, used to be very heavy, lost a lot of weight, and have hanging skin and also bulges. The overall approach to treating excessive skin and bulging of the abdomen is you have two components that you must fix with a tummy tuck. One is the muscles that are located in the belly. The six-pack muscles are usually separated by having babies and or weight gain and weight loss, and we put those back together during a tummy tuck. The excess skin now, which is the second part, is usually an elimination of skin that's located below the belly button, usually at least up to the belly button, sometimes even more. A lot of people will come in asking about a mini tuck versus a full tummy tuck, and there are differences between the two. The people who purely qualify for mini tucks are not many. In general, when you're qualifying for a regular tummy tuck, you have excess of skin above the belly button, below the belly button, and looseness or separation between the muscles, both above and below the belly button. A lot of people will come in asking about mini tummy tucks versus full tummy tucks, and there is a difference between the two. A full tummy tuck takes care of problems that are above the belly button as well as below the belly button. So the problems are excess skin, again, below and above the belly button, and then separation of the six-pack muscles above and below the belly button. A mini tuck is only useful in very few patients because those patients are very specific. They only have excess below the belly button, and not a lot of it, and also only separation of the muscles below the belly button. So in those patients, you can use a mini tuck, but in most patients, they're not limited. So you must do both above and below, which makes it a full tummy tuck. What are the ideal candidates for tummy tucks? The most ideal is somebody who's in regular weight, meaning that their weight is within normal limits, and they have very limited or relatively limited excess outside of the belly itself. They don't have excess outside of their hip bones. They don't have excess around their back and around the love handles area. That's an ideal patient. Most patients today don't present as ideal patients because they have excess in more than just between the hip bones. So as you get further out, maybe they have excess onto their sides. They have depositions of fat in the lower back. Their buttocks is fallen. Their thighs have fallen. All those things require more than just a regular tummy tuck. What do patients, when they come in, they're always asking, what am I have to deal with after surgery, after having a tummy tuck? Number one, there's a recovery period after surgery. Fortunately, these days we have some excellent ways of dealing with discomfort, much better than we had in the past with some medications that we inject at the time of surgery that reduce the pain significantly. And we don't tend to use a lot of narcotics, which is really helpful because narcotics can make your post-operative experience or after surgery experience not great. The next aspect is, what's my scar gonna be like and where is it gonna be, that sort of thing. The scarring from a regular tummy tuck is intentionally kept within an underwear line. Now, there's different kinds of underwear and different extents of underwear, but in general, it's kept underneath what you'd say a bikini line. There are different shapes for different tummy tuck procedures or different tummy tuck approaches. Some are a little bit flatter scars, again, fitting underneath the bikini. Some are a little bit more angulated like a French bikini cut. The extent of it, how far it goes around the belly, is dependent on what we're dealing with originally. If it's just the belly, then it's relatively a small scar. If it's much more extensive issues to the sides, we might have to extend the scar. A lot of patients will come in asking about liposuction versus tummy tucks. What's that used for and what's this used for? So let's go over that a little bit. A tummy tuck involves cutting excess tissue out, mostly from the belly button down, and also tightening the muscles on the inside. So the six-pack muscles are separated and you tighten them. It requires large scars, like scars that go in the bikini line. And generally when you're removing skin, you're not only removing skin, you're removing skin and fat underneath it. Now, liposuction is a completely different concept. It is basically like removing air out of a balloon. So if you think of the skin as the outer skin of the belly and the whole trunk, and then fat is what's inside the balloon. Liposuction is like putting something in that sucks out the fat and reducing the size of that balloon to a more appropriate level. A lot of tummy tucks, we combine liposuction in the areas that we are not operating in, or sometimes even in the areas that we're resecting, just to give things better contour so they fit the underlying muscle system or muscles and bones. You can think of it like a mannequin, and that's the muscles and bones, and the skin and the fat are like a dress that's on the outside. So what you're trying to do is get that outside dress to tighten. What kind of result should people expect from liposuction done alone? If the patient is ideal, meaning that that skin fat envelope or the skin cover with the fat that's on the inside being the air like that's on the inside of the balloon, if the cover or the balloon has got good skin quality, then as you reduce the fat, the skin will contract back down and it can be a very good result. If the skin quality is like a balloon that's been blown up for a couple of weeks and then you take the air out, it will not contract back down. So that's a bad candidate in the first place. So hopefully your plastic surgeon is good enough to recognize people who are good candidates and bad candidates. Good candidates should have a good contraction. Bad candidates, the skin will wrinkle in the end, it will not contract back down. One should consider a few things when you're considering liposuction or body contouring in general. Number one, you should be healthy. These kinds of operations are elective and they're not done on people that are not well. It is not reasonable to take a risk on an operation when you're ill or you have some major medical problems where the surgery would put you at a tremendous amount of risk. Number two, body contouring is not surgery that eliminates fat or makes people thinner. People think that that's a way to lose weight. It is not. Ideally, patients should be at their lowest constant weight before they consider surgery and should not consider it a weight loss surgery. The most ideal patients are patients who are relatively within normal weight and are stable so they don't change up and down continuously. Number three is that surgery should be done to improve your life. It's not going to change your life to an absolute zenith of being happy. Most people who are unhappy in life, they're not going to be made happier by surgery. Those situations require much more than surgical interventions, even extensive body contouring surgery.